There are two ways that you can make a permanent mistake when you're new to Medicare. The first is by choosing the wrong option out of the choices you have. And the second way is by choosing the right option, but the wrong plan or insurance company within that option. My promise to you is that by the end of this two-part video series, you will understand Medicare, be confident in your knowledge of Medicare, and be confident in the choices that you must make. This video is for those who are researching Medicare, their Medicare options, and want to know how to choose between a Medicare Advantage plan and a Medicare Supplement plan. Most importantly, in this video, I'll show you how to avoid making a permanent mistake with your Medicare. In previous years, my Medicare Explained video was just a one-video presentation. But over time, the length of the video updates has grown to such a proportion that it's best divided into two separate videos. I don't know about you, but I am not a fan of videos that go an hour long. But these videos are for you. Please let me know in the comments below if you prefer a two-part video or just one long video that lasts almost an hour. So this is Medicare Explained Part 1, and this video should be about 30 minutes in length. Medicare Explained Part 2 will be about 20 minutes in length. I'll show you the table of contents for these videos in a moment. This is a good video to take notes. Viewer comments from my past versions over the years of this video indicate that a lot of people will watch this video 2 or 3 times and take notes. If you do, I can assure you that you'll be the smartest person in the room when it comes to your Medicare. So stick around. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. My company is one of the premier Medicare insurance brokerages in the United States. We are an independent insurance broker specializing in your Medicare retirement needs, and our services are free to you, the consumer. If you like these videos, you're not alone. My Medicare Explained video has been one of the YouTube's most popular educational videos on Medicare. So check out our 5-star reviews and call us. You'll be glad you did. I have a clickable table of contents and video descriptions below if you wish to navigate to a specific topic within the video. If you just click on that subject in the table of contents below. I know also some people like to watch certain sections more than once, so having a menu system helps you navigate that. So this is the table of contents for both Part 1 and Part 2 of this Medicare Explained series. Also, I'm going to be showing the table of contents here for just this section, just Part 1, so if you are watching this on YouTube or even on TV, you can navigate as well. So to keep this video brief, I will leave out the details of how and when to enroll in Medicare. That's a video all to itself that I recently updated. The new How to Sign Up for Medicare video, in the upper left here should be linked. It's where I walk you through the enrollment process as I sign up for Medicare. Plus, there are other videos to show what happens afterwards, what to expect after that. So please subscribe to my video channel so that you can see them all. So let's start this Medicare video with Original Medicare. When you sign up for Medicare through your Social Security website or local office, you're signing up for Original Medicare Part A and Part B. No matter what else you decide to do with your Medicare, this is a mandatory first step that you must take. Original Medicare is in 2 parts that can be enrolled in separately. Inpatient care insurance is called Medicare Part A. There's also a Medicare Part B, which is outpatient care insurance and physician services. Most people will enroll in Original Medicare online at the Social Security website. And that is what you should do unless you or your spouse has creditable employer-sponsored health care and are actively working past your turning age 65. If that's your situation, you should see my video titled Working Past 65, Avoid the Medicare Penalties and Mistake, link above my left shoulder and, of course, in the show notes below. When you enroll in Medicare, you're signing up to receive your Medicare Part A and your Medicare Part B. Once you sign up for Medicare Part A and Part B, you must make one of 3 choices with your Medicare. Now, I'll detail those choices first in this video. But before I go over those choices, Let's quickly answer the question, what is Medicare Part A and Medicare Part B, and what does it cover? The goal of original Medicare is to cover everything medically necessary to diagnose or treat any disease, condition, or injury. Original Medicare relies on your medical provider to determine medical necessity. Medicare Part A is that portion of your health insurance that covers you when you are an inpatient. As soon as you are registered as an inpatient in a hospital, a nursing facility, or hospice, or any medical facility, Medicare Part A takes over. So I want you to think of your Medicare Part A as insurance for inpatient services. If you've not been an inpatient in a hospital before, you may not know that except for physician services, everything Medicare related that's involved with your stay is covered under Medicare Part A. Now, this includes any medications you take. And in fact, you can't bring into the hospital medications that you're taking at home. The hospital will provide them for you so that they can control what medications that you're on. If you're going in for surgery as an inpatient and your doctor has ordered the necessary required pre-op tests, those too are covered under Part A. If you've been an inpatient for at least 3 midnights and are being discharged to a skilled nursing facility, Medicare Part A coverage will include most or all of that skilled nursing care. And of course, Part A also covers hospice care, whether it is in-home or at a facility. However, Part A does not cover physician services. Physician services and durable equipment are covered under Medicare Part B. Physician services can be doctor visits while you are an inpatient in the hospital, or it could be your surgeon, your anesthesiologist, and so on. The only exception may be or could be doctors who are residents at a teaching hospital. Their services can sometimes be billed by the hospital under Part A, and it really depends on the hospital. For most of us, we've paid for our Medicare Part A with a payroll tax during our or our spouse's working years. That's the Medicare tax deducted from every paycheck you've had from your working years, and that has paid for your Medicare Part A. If you or your spouse have paid that tax for at least 10 years, your Medicare Part A is fully paid for. In that case, when you start your Medicare, Part A has no additional costs for you, so your Part A is paid for. If neither you nor your spouse paid that Medicare tax for at least 10 years, then you can still get Part A, but it will cost you a monthly premium. For most of us, Medicare Part A is already paid for. So what about Medicare Part B? Medicare Part B is your outpatient and physician services insurance. If you're not an inpatient, you must be an outpatient, and that's covered under your Medicare Part B. Medicare Part B is the insurance that you use when you see a doctor or when you have lab tests or preventive care. It also covers outpatient durable equipment like insulin pumps, wheelchairs, walkers, and so on. Medicare Part B is that part of your health care insurance that people will use most often. Now, Medicare Part B has a required monthly premium, so you have to pay a monthly premium for your Medicare Part B, and everyone must pay for Medicare Part B. Everyone 65 and older needs Medicare Part B unless you are actively employed or your spouse is actively employed and delaying Medicare because you or your spouse are continuing with employer health insurance coverage and that employer has 20 or more employees. Absent that, you'll need to get Medicare Part B and you must pay for it. As an aside, if you are considering staying with your employer coverage, please do not get your Medicare Part B. This is very important. Once you start your Medicare Part B, you start a 180-day timer that is really important to your guaranteed issue for your Medicare Supplement plans. I will have more on that later. For now, please do not start Medicare Part B until Medicare is going to be your primary insurance. So are you with me so far? What about the cost of Medicare Part B? How much you pay for your Medicare Part B depends on your income, specifically your modified adjusted gross income from your tax returns as of 2 years ago. It's always a rolling 2-year look back at your income. In 2024, the base monthly premium for Medicare Part B is $174.70 a month. As I film this video, the official Medicare estimate for Part B monthly premium for 2025 is $185. That's not been announced yet, but that is the estimate. And they should announce the actual Part B for 2025 premium typically between mid-October and mid-November. You can see the official estimates of the Part B premium and deductibles for each year out 10 years into the future in a video that's linked above my left shoulder and in the show notes. And these estimates are great for your financial planning. People with higher incomes, with individual incomes of $103,000 a year or more in 2024, or twice that if you're filing your taxes jointly, will pay a higher monthly premium from both Medicare Part B and your Medicare Part D prescription drug coverage. The higher monthly premium is called your Income-Related Monthly Adjustment Amount, or IRMA for short. If you are subject to IRMA, the premiums for both Medicare Part B and Part D prescription drug coverage are increased. As an aside, the IRMA surcharge is not a penalty, it's not a tax. Medicare Part B costs the U.S. government, us taxpayers, more than $650 per month per person. When you are subject to IRMA, you are simply subsidized at a lesser rate than those with lower incomes. Of course, I have a video and an article that details IRMA, plus how you can appeal, how you can avoid the IRMA surcharge. And that too is linked below and above my left shoulder, so it's in the video descriptions below. Or you can use the search tool on my website, MedigapSeminars.org. So if you go to MedigapSeminars.org and type in IRMA, it will bring you to the article and the video that I have produced for you. No matter what choice you make with your Medicare, you must pay for your Part B and any IRMA surcharges that you qualify for. So to recap, Medicare Part A is your inpatient coverage. It's going to cover you if you are admitted as an inpatient into any medical facility like a hospital or a nursing facility or hospice. Medicare Part B is your outpatient services and physician services. That's the part of Medicare that you'll expect to use most often. Medicare Part B covers you when you see a doctor. It covers you for your lab tests, your preventive care, and all of the other outpatient services. It also covers for Medicare medical equipment like a CPAP, a walker, or a wheelchair. Together, Medicare Part A and Medicare Part B are called Original Medicare, sometimes called Traditional Medicare. It's an important term that you should remember. We will refer to it several times during this video series. Original Medicare is Medicare Part A and B combined. That's the foundation of Medicare. With that out of the way, next is the most important information in this entire video two-part series. If you get nothing else out of this video, please remember the two greatest benefits of Original Medicare that I'm about to cover next. After that, I'm going to talk about your three options from which you must choose one and how to avoid making a permanent mistake. Now, I've seen my competitors attempt to compare Medicare Advantage to Medicare Supplements by detailing the benefits and costs and hypothetical situations. It's enough to make your eyes gloss over. In my humble opinion, they're missing the big picture. So here's how I look at it and what I've shared with many thousands of people that we've helped with their Medicare. I started seeing years ago a theme develop over and over when people voiced why they chose Original Medicare as their primary coverage. It was consistently because of these two benefits. The two greatest benefits of having Original Medicare as your primary health care are, one, that with Original Medicare, you can see any doctor in the United States or its territories as long as they accept Original Medicare. And that is over 98% of all medical providers in the United States and its territories. You have national insurance coverage. With Original Medicare, you do not need to obtain approval from a primary care provider to seek out a specialist or to get a second opinion. You have the freedom to see the medical professionals that you want to see. If there's a doctor halfway around the country that can save your life, you can see them, and Medicare will pay their portions of the Medicare bill. The second of those two most important rules is that no insurance company can interfere with your health care. There are other insurance options that allow insurance companies to demand that your doctor seek their prior approval before any treatment can be recommended. It's called prior authorizations. The intent of Medicare is to cover everything that's medically necessary. It's a government program, not for profit, and they rely on your doctor to determine medical necessity. There's no Medicare department that your doctor submits a request for pre-authorizations to, and there are no pre-authorizations. Medicare covers what is medically necessary to diagnose and treat any disease, condition, or injury, period. As a result, your healthcare decisions are made by you and your doctor, not an insurance company. That's important. You have the freedom of choice over your doctor that you choose, and you have control over your healthcare. Those are the two greatest benefits of original Medicare, and for most, their motivation is to preserve those benefits for themselves. Many people will trade in those two benefits without realizing the gravity of what they've done, and more on that in a moment. For now, remember those two benefits of original Medicare as you review your options. So now let's look at your options. Once you sign up for Medicare Part B, you must choose between one of three options. Your first choice would be to do nothing. Just keep your original Medicare Part A and B and hopefully add prescription drug coverage through Medicare Part D. Unfortunately, original Medicare was never intended to be standalone health care. It has no maximum out-of-pocket limit. With just Medicare Parts A and B alone, you not only must pay the deductibles and coinsurance associated with Medicare, you have no maximum out-of-pocket limit on your financial risk. You have unlimited financial risk in the worst-case scenario. One of the purposes of insurance is to protect you from personal financial catastrophe. Having just original Medicare doesn't do that. Still, it's a choice, and some people make, and it's a choice that you can make if you wish. Now, to see the deductibles and copays and coinsurance of Medicare, you can click on the link above my left shoulder, and these numbers adjust with inflation each calendar year. I will also include it in the show notes below if you want to click on that as well. And you can also find that information as it's updated annually on my website under MedigapSeminars.org, and just choose the Resources tab, along with a lot of other important Medicare information. Before your eyes gloss over looking at this, please understand that these deductibles and coinsurance, etc., are important if you are going with just original Medicare. But both of your next two options render these details moot. That means you don't have to memorize the deductibles and coinsurance and so on. Your other two options create a maximum out-of-pocket limit on your potential medical expenses, protecting your financial risk. You can do this by either adding a Medicare supplement to your original Medicare or by trading in your original Medicare for a Medicare Advantage plan. So let's go over the pros and cons of trading in your original Medicare for a Medicare Advantage plan first. Then we'll look at the pros and cons of choosing a Medicare supplement. And finally, we're going to look at demographics. Who usually chooses an Advantage plan and who usually chooses a supplement plan? Lastly, keep in mind that whatever plan you choose, you may have to keep for the next 25 or 30 years. And I will go over what that means for your long-term planning during retirement. Medicare Advantage plans are also referred to as Medicare Part C. This nomenclature is a bit misleading, to say the least. In fact, some organizations have attempted to work through Congress to prevent Medicare Advantage plans from using the term Medicare because Part C replaces Medicare. It's a Medicare replacement, not Medicare. Medicare Advantage plans are regulated, which means that Medicare has rules the Advantage plan should follow, and as long as they stay within those guidelines, they can roam free with their own rules, so to speak. Medicare Advantage plans were originally called Medicare replacement policies because that is what they do. They replace your Medicare Parts A and B with plans administered by insurance companies. Keep in mind, as mentioned earlier, you must still pay your Medicare Part B monthly premium and any IRMA surcharges. What are some of the pros and cons of a Medicare Advantage plan? There are many different types of Medicare Advantage plans, but over 85% of Advantage plans are either an HMO, a health maintenance organization, or a PPO, preferred provider organization, similar to the types of plans you may have had before you get your Medicare. In these videos, I will be limiting my discussion of Advantage plans to these two types, HMOs and PPOs. So HMOs, now in general, and yes, I know when I say in general, that means there are exceptions, but in general, HMO plans will only allow you to see in-network providers. You have no insurance coverage outside of your local network. PPOs will allow you to see a doctor out of network. However, there is a huge misconception with this feature. Many insurance agents, encouraged by some insurance companies, will lead you to believe that you can see any doctor that accepts Medicare if you have a Medicare Advantage PPO. That is not entirely accurate. If you have a PPO Medicare Advantage plan and you want to go out of network, the out-of-network doctor must first accept your insurance. Doctors are under no obligation to accept your Medicare Advantage insurance and see you. The simple truth is that with a Medicare Advantage PPO, you can ask an out-of-network doctor if they will accept your Medicare Advantage plan. Those doctors can and usually do say no. To be clear, with an Advantage Plan PPO, all you can do is ask if they will accept your insurance out of network. If they don't have a previous relationship with you, they're very likely to say no. On the positive side, Medicare Advantage plans will have a very low or sometimes even no monthly premium. So financially, the monthly premiums are not going to be a burden for most people. Advantage plans place an annual maximum out-of-pocket limit on your financial risk. But keep in mind, that is only for approved services. More on that in a moment. Medicare Advantage plans often come with a bundled Part D prescription drug plan. And this can be a double-edged sword, as, again, I will cover in a moment. Lastly, many Advantage plans may include extra benefits, like some dental benefits, a gym membership, and so on. So what are some of the cons of Medicare Advantage plans? Well, first and most importantly, because the insurance company is in charge of your health insurance, you give up the two most important benefits of original Medicare. You're no longer free to see any doctor or visit any medical facility as long as they accept Medicare. You're limited to a network of local medical providers and medical facilities as defined by your insurance company. Because the Advantage plan offers only local coverage, by the way, there are over 3,000 different Advantage plans across the country, each with their own costs and their own benefits. Some plans have limited non-local coverage, but for the most part, the only insurance that you'll have outside of your local area is emergency or urgent care. If you're traveling around the country or internationally, that alone should rule out an Advantage plan as a choice. In addition, your healthcare decisions are no longer between you and your doctor. Your doctor must seek permission from the insurance company for any non-urgent medical procedure. Now, permission is called a pre-authorization or prior authorization. By requiring pre-authorizations, the insurance company has the authority to deny or modify the procedures your doctor recommends. Now, to build on this issue, many insurance companies and agents will tell you that a Medicare Advantage plan will cover all the same benefits that you get from original Medicare. That is not accurate. The Advantage plan will have benefits from all the same category of benefits as found in original Medicare, not the same benefits and certainly not the same costs. So here's an example to help illustrate, and this is a very important point. So let's say your doctor recommends 20 physical therapy sessions to help you recover from an injury. If you have original Medicare, you're going to get 20 physical therapy sessions, no questions asked. But with an Advantage plan, the insurance company may think that's too costly, and they're going to modify your doctor's recommendation to 5 physical therapy sessions or deny them altogether. Both plans offer physical therapy. It's the same benefit category, but obviously not the same benefit. Another weakness of an Advantage plan is in the bundled Part D plan. Now, it's presented as convenient because you don't need a separate Part D card, but like Advantage plans, the benefits and costs of each Part D plan is different than any other Part D plan. Because of this, you can find that the Advantage plan with the best Part D drug prices for your situation may not have your doctor in network, or the plans that accept, that your doctor accepts that are in network may charge higher prices for your prescriptions. So you're going to have to make a choice. When your health insurance and drug plans are bundled, you often must choose between the best prescription drug coverage and the best network of medical providers. Can't always have both. That's why I mentioned earlier that a bundled Part D plan can be a double-edged sword. Another negative with Advantage plans is that even if you do not have a monthly premium, you still have deductibles and copays and coinsurance defined each year by the insurance company, not Medicare. Keep in mind the Advantage plan health benefits are supposed to be roughly equal to the health benefits of original Medicare without a supplement. I mentioned that one of the benefits of an Advantage plan is that they do set an annual maximum out-of-pocket limit on your financial exposure to medical bills. But for many, that maximum limit is high enough to also be a financial challenge. For 2024, the maximum limit that's allowed for an Advantage plan is, this is your exposure, is $8,707 for in-network services and $13,330 if you use out-of-network services. Many of you say, well, wait a second, my Advantage plan or this Advantage plan I'm looking at has less. Yes, an Advantage plan may choose to have a lower limit, and many do, but those limits, they can't have a higher limit than the maximum set by Medicare. And this is an annual limit that only pertains to procedures approved by the insurance company. And that limit, like any deductibles of your Advantage plan, resets to zero every January 1. The last negative about Advantage plans is that Medicare Advantage plans are annual plans. They are not guaranteed renewable plans. That means that the costs and benefits of every Advantage plan change every year. That is why if you have an Advantage plan, you must reshop your plan each and every year during the annual enrollment from October 15th through December 7th. As a weakness, in addition, you can't make long-term plans about your healthcare costs and benefits because they both change annually. So the last point about Medicare Advantage plans that is a feature that you should be aware of is that there is never any medical requirements to get an Advantage plan. In other words, it doesn't matter if you're healthy or if you're in poor health. Every application for an Advantage plan is accepted as long as you have original Medicare. But you can only apply for an Advantage plan during your initial enrollment and then only during specific annual enrollment periods or special enrollment periods, not any day of the year. Now, that was a lot of negatives and certainly enough to make you wonder who would decide to buy an Advantage plan. This is interesting. Recent statistics show that about the same percentage of people on Medicare choose an Advantage plan that choose a supplement. And I'm going to discuss why in the Part 2 video to this. So first in Part 2, I'm going to go over the pros and cons of a Medicare supplement plan and then discuss who usually chooses an Advantage plan over a supplement and vice versa. And all of this is important and meant to help you make an informed decision about your Medicare health insurance. In Medicare Explained Part 2, you will learn about Medicare supplement plans, how to choose between supplement plans and Advantage plans, how not to make a permanent mistake or how to make a permanent mistake if that's what you want to do, and how all these plans will adjust over time for inflation. Please like and subscribe to this video so that you can easily find all my Medicare videos and be alerted when I publish something new. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.